A UK health alert is triggered over the use of an anti-epileptic drug, Valproate. It comes after a review found children exposed to the drug in the womb and are at high risk for serious developmental disorders and or congenital malformation. Joining me now to discuss the alert is Health Services Authority Chief Pharmacist Colin Medford. Thank you so much for joining us tonight.
Thank you. It's a pleasure to be here.
Now, this health alert, I understand this drug has been used for many years now. Why was this issued now?
Okay. The thing is, the side effect of the drug has been known, but the adverse reaction has been known for a while. But the extremity of it was only discovered lately, and the UK, having done some extensive research into the product itself, realized that it was more extensive than they thought. It is thought that about 30 to 40% of persons within childbearing age who have taken this drug and have had a child experienced a deformity of some sort. So that is very high. It's a very big figure. And as a result of that, the health regulatory boards in the UK, they decided to put together some warnings for physicians, both hospital and otherwise. And as a result of that, we've now got this warning, which has been solidified in November last year, and we're acting on that.
Now I mentioned this drug has been used for a number of years. It's used to treat epilepsy, and I believe you also said bipolar disorder as
conditions,
well.
Yes, that is correct, and is very effective in doing so. It is actually very effective for the patients who have been on it for years, and I think that's one of the reasons why it is still around. But as a result of this situation now, precautions have to be taken by those persons who fall within that group of childbearing mothers.
Now, of course, we have this drug on the island, and I'm sure it's in prescription and in use.
Absolutely.
Yes.
Yeah, it's actually available as sodium valproate, valproic acid, epilim, or Depakote. Those are the names that are most popular. There may be other brands around, but most people will know it as a Valproate.
Now, someone that's using this right now or thinking about becoming pregnant, I mean, what kind of advice can you give to them right now? Or somebody that's actually been taking it and is now pregnant, say a couple of months pregnant?
Well, first of all, it must be reiterated that the persons targeted here are persons who are within the childbearing age. Those persons who are planning to become pregnant while taking the drug, or are pregnant, or are within that range. And what we're hoping to do is to bring the awareness to them so that they can come in. We're advising them to come to see their physician as soon as possible. Whether you're in the private sector or government, doesn't matter. The important thing is that you see your physician. And also that if you are taking the drug, you do not stop taking it suddenly. You continue to take it, but you see your doctor for further advice.
Because that could cause effects too if you just suddenly stop taking the drug.
It's really not recommended to stop taking medication like this, especially suddenly. You don't want to trigger a seizure. You don't want to worsen your condition. The idea is for them to continue their care, but to come in and seek alternatives or get advice.
Okay, now you mentioned advice. Now you said they could come into HSA to get advice. Can they go on a website? I mean, how can they get further details about this?
What we've done at the HSA is we've identified all of our patients who are on the drug. We've isolated them and we've contacted most of them already and told them what they're supposed to do. And then ongoing, we're going to produce a sticker or a card which will accompany your medication as long as you're prescribed sodium valproate. Male patients need to know it doesn't apply to them at all.
Yes,
they can continue taking the drugs.
And you did mention it's only affected to the child inside the womb. I mean, it doesn't really technically affect the mother. It's just to the unborn child.
Exactly. What I should say is that the drug causes marked malformations in children whose mothers have been taking the drug while they're pregnant. Now, some people may be asking as well, if I've been taking this drug for 15 years, will it affect me if I become pregnant? The thing is not how long you've been taking the drug. The point is if you're taking the drug while you're pregnant or when you become pregnant. And that's the important thing. And we want patients to know that if they do become pregnant, or plan to do so, it is very imperative that they see their physician.
All right. Now, is there a number they can call? You said they can come into HSA, but is there a number they can call to
Well, they can call the hospital's direct line, which is 949 8600, or they can call Pharmacy at 244-2716 or 244-2715. We will certainly direct them to their physician. And like I said, we've been calling all of our patients who are on it already.
That's really good.
So they've been made aware. There's another aspect of this that needs to be known as well. Contraception is recommended if you're of childbearing age and you're taking the drug, but you need to see your physician to have that solidified and verified for you, because not all contraception is advised either. It must be effective.
Definitely. Now, Mr. Medford, we have run out of time, but thank you so much for this information. And of course, they can go to the HSA or get some more information, for the women that this drug could be affecting.
Thank you, too.
All right. Thank you.